Okay, I'm here with Mr. Skeleton. Mr. Skeleton, can you state your name and date of birth back to me? Okay, great. I've done my 2 identifiers, Mr. Skeleton. Do you have any allergies? Mr. Skeleton doesn't have any allergies, and I'm checking the chart to double check for any allergies or contraindications, and I also want to check the physician's order for the IV. And it looks like we're going to do our IV today, Mr. Skeleton, so we can infuse the medications for you. Do you have any questions for me? No? Okay. I'm going to take vitals as needed per the physician's orders. And I've got my second hand watch here to do our drip rate. So we're going to perform hand hygiene and provide privacy. We've got our 500 milliliter normal saline, 0.9%, our 50 milliliter normal saline, the 2 tubings for our primary and secondary, and labels for labeling our IV fluid. I'm going to start by checking the packaging for the IV fluids and the tubing, and everything looks good. I'm going to remove the coverings and get everything prepped for priming our tubing here. I'm going to clamp my primary tubing shut so that when we spike and invert our tubing onto our IV pole, that it doesn't come out. So I'm going to remove the cap from my spike here and the plunger to my IV fluid, and I'm going to maintain sterility and spike my IV bag. And that is spiked. I'm going to make sure not to hurt myself too. And I'm going to hang that onto my IV pole here. Okay, now we're going to start priming our IV tubing, but before we do that, we're going to get our chamber here filled with half of normal saline. And I'm going to make sure that this is uncoiled. And to prime the IV tubing, we're going to keep an eye on air bubbles and how the normal saline flows. And we're going to invert our ports each time the normal saline comes through. So I'm going to gently open up my chamber, my clamp here. And I'm going to remove the cover for the end of the tubing here, making sure not to touch that to anything, keeping it sterile. I'm going to open it up, my tubing here, to get the saline flowing through. I actually have it clamped both ways. Okay, so you don't want that flowing too much, so you don't lose too much saline too quickly. So we're going to get that coming through. And it's going to reach my first port, and I'm going to invert my first port as it comes through. And I'm going to tap my port to release any air bubbles. And I'm going to keep doing that for the rest of my ports. Follow that to the next one. I'm going to invert that and tap out excess air. I'm going to follow that as well. The next port, invert, and tap out excess air until we get to the end of the tubing and everything is primed with the normal saline. Okay, so we've got our tubing primed and it's ready for infusion of medication. So now we're going to do our flow rates. We're going to check the drip rate calibration, and that is a 15 drops per milliliter tubing. So that's what we're going to use per the physician's orders. I'm going to check the physician's order for the IV fluid type and the amount of IV fluid. And we're going to be doing 500 milliliters of 0.9% normal saline over 4 hours. So that's going to equal out to 21 drops per minute. And for the sake of this video, we're going to divide that to quarters, so about 8 drops per 15 minutes per 15 seconds. So I'm going to get that calibrated on here with my watch, and then I will show you how I did that. So I'm going to take my tubing here and get it to about 8 drops per minute per 15 seconds. So I've got that all done now, and I'm going to show you real quick. So we've got that all complete. Now that I've got my drip rate all ready, what I'm going to do is make a label for that has the drip rate that I calibrated out and the calculation, and I'm going to put that onto my IV bag as well, so that the next nurse that comes on to shift is aware of the drip rate that we've got going for the patient. So with that, we're going to now do the piggyback med. With the piggyback med, we're going to have our 50 milliliters of normal saline and our secondary tubing. I'm going to check the physician's orders and do my 6 writes and my 3 checks, and also check the patient for any allergies. And I'm going to check the chart and the MAR for that. And I'm going to check also the compatibility of the IV meds with the IV. So I've done that. I've performed hand hygiene and provided privacy. And I am making sure to check that I've obtained the correct medication dosage. And I'm checking the dosage and expiration date of my IV, my piggyback med here. And then I'm also going to check the integrity of the packaging and how my IV bag and my tubing look like, and I'm going to get it ready to be spiked. So I'm going to remove the butterfly of my secondary bag here and my secondary tubing cap, and I'm going to clamp my tubing shut so that everything doesn't come spilling out, and I'm going to spike that safely and get it hung onto my IV pole here. So I'm going to remove that, and I'm going to make sure to have my hanger as well available. I'm going to hang my secondary, my piggyback med, and my hanger for my primary bag. Hang my primary bag hanger first, and then my secondary tubing. Prior to infusion, I want to make sure that I do my 2 identifiers and checking for any allergies again. I'm going to hang this, and then I'm going to hang my primary bag lower than my secondary bag so that it infuses properly. And then we want to get it connected, so I've got everything shut. I'm going to cleanse the port that's closest to the bags, and I'm going to insert the secondary tubing to the primary tubing. I'm going to make sure that the secondary tubing clamp is open all the way, and then I'm going to calibrate with my primary tubing to about the calculated dose of about 7 drops per 15 seconds. So I'm going to get get that going. And I'm going to be checking my watch to make sure that I've got that properly done. Okay, so we've got that going. And we've got our piggyback med being infused. When the piggyback med is totally infused, we want to make sure that we recalibrate our primary bag to the original dosage for the primary med, and we're going to document any adverse reactions from our patient. We're also going to document the dose, time, the drug, and the route, and we're going to put that in the MAR and the input and output record, and that completes the piggyback med. So I'm going to get ready for IV push. I'm going to remove our piggyback because we're all complete with that. We no longer need to do piggyback. For IV push, we're once again going to check the physician's orders for the medication. We're going to do our 6 writes and our 3 checks, and we're also going to check the patient again for any contraindications or allergies. So for IV push, we're going to check for compatibility of the drug with the primary solution here. If we don't have compatibility, we're going to check the line that we can still use it, or we will check to see if we need to use a new site for the IV. If we're still using the line, we're going to have a syringe of normal saline. We're going to cleanse the port, administer our normal saline, and then we're going to cleanse the port again and administer our drug. So because we have compatibility of the drug with the IV solution, we're going to do our 2 identifiers prior to infusion. We're going to check the dose against the MAR and check everything against the chart. I'm going to make sure to check my patient's band and check for any allergies. And then I'm going to check for patency of the IV site. For patency, you're looking for phlebitis, infiltration, and occlusion of the IV site. Everything looks good, so we're going to clamp our tubing shut. We're going to insert our syringe here and inject our medication. Prior to withdrawing the syringe, you're going to release the tubing and withdraw your syringe. And you're going to document the dose, time, and route. And you're also going to check for any adverse reactions from the patient and document that and react as well. So now we're going to do IV lock. With IV lock, you're going to have 2 to 3 milliliter syringes of normal saline. You're also going to have, per hospital policy, your heparin syringe as well, and your medication syringe. Prior to administration, you're going to go to the closest site for to the IV site, the closest port to the IV site, and that's what you would also do for IV push as well. You're going to cleanse that. You're going to insert your syringe of normal saline. You're going to apply that, cleanse again, insert your syringe for your medication, cleanse again, insert your normal saline, once again your second syringe, cleanse again, and insert your heparin per hospital policy. When you're inserting your normal saline, you're going to do that at about in a pulse-like manner for both syringes, and you're also going to do your medication over the appropriate time frame that you would find in your drug book. So again, you're going to document your time, your dose, and your route, and you're also going to document the normal saline that was used. You're also observing for any adverse patient reactions and reacting and documenting properly. Now we're going to go into removing the IV. For IV removal, you're going to check your physician's orders and that you can remove the IV. Prior to removal of IV, you want to do your 2 patient identifiers and check for any allergies. So we've done all that and we're good to go. We're going to start by performing hand hygiene, closing the curtain, and putting on clean gloves. And then we're going to go over and loosen up the edges of the IV tape towards the IV insertion site, and making sure that if the patient is elderly or if they have very thin skin, to be very careful and cautious not to rip their skin. So I'm removing the tape towards the insertion site, and I have a gauze ready in my non-dominant hand, and I'm getting prepared to remove the catheter and apply pressure for about 1 minute. When I remove the catheter, I'm doing that in a slow and steady manner, and I'm immediately applying pressure to the insertion site of the IV. I'm applying pressure for 1 minute, and I've got a Band-Aid ready to go when I have that nice and clean. If the patient is on anticoagulant therapy, you want to apply pressure for more than 1 minute to make sure that there's no excess bleeding, and you're going to make sure that there's no blood when you remove the gauze. So we've got our IV removed. We're going to document the tolerance of IV removal and that the IV was removed. We're also going to ensure patient safety by lowering the bed, raising the side rails, bringing the bedside table close by, and leaving the call light as well. And that concludes IV's validation.